Kind, really passionate and caring.
Dedicated, caring and resilient.
Passionate, committed, resilience.
Skilled, collaborative, dedicated.
Resilient, community-focused, adaptable.
Caring, family, collegial.
Resilient, inspiring and awesome. Something I've seen in the last 2 years that's been extraordinary, I guess, is just the coming to arms and everybody wanting to be a part of something incredible and something unprecedented, and everybody wanting to help in some way, shape or form, even if it was just in the smallest way, just coming together.
It's an enormous credit to you all that the impact of COVID in the Yorke and Northern Local Health Network has been minimal. Compared to what we have seen interstate over the last 2 years, we dodged a bullet, and we only dodged a bullet because of your skill, dedication and commitment.
So during the last couple of years, we've really witnessed right across the region how staff support each other. I know sites that have put some COVID caring boxes together with food and other essentials in case any of their colleagues get struck down, and they can drop them off and deliver them. Watching all the staff interconnect and contact each other and work across different sites has been absolutely amazing, and so proud of each and every one of you and the way we've come together as a complete region.
Everyone has embraced digital technology. That's probably been one of the most positive things that it has come out of COVID. We have embraced digital technology, the use of Facebook and Teams, so that we can have meetings with, consumers can have meetings with families interstate, overseas, even within their own town when they couldn't visit. Once the borders opened and the restrictions eased, we've had staff members who've taken the facility residents to the zoo, taken them fishing. We've had staff work extra shifts. We've had staff work over and above to just make sure that the care is not impacted for residents.
Staff across this organisation are true professionals. They have continued to provide services to their local community whilst under immense challenges. They have continued to be absolutely professional, committed and resilient during this entire time. And it's absolutely great that as a network we have come through what's probably been the most challenging 18 months a health system has ever seen before in a great way.
I sincerely want to thank all of the staff across the Yorke and Northern for their resilience and collegiality, particularly over the last couple of years. I'm so proud of each and every staff member for the way they have stepped up, worked together, supported each other. So proud of you, appreciate you, and looking forward to continue working with you.
Thank you for keeping our consumers of our aged care services safe, well and supporting them to live their best life.
You've always gone over and above to try and support your clients, and I think at times that's come with a great personal cost, particularly when each and every one of you were dealing with other pressures outside work throughout the last couple of years, not being able to see your family, having kids doing schooling from home, and also the raft of restrictions. So from the bottom of my heart, I'd really like to say thank you for going above and beyond.
The board acknowledges the burden that this has placed upon you and your families, colleagues and associates. We know that many of you have responded to putting in extra hours at work when ideally you might have been focused on your family and other pursuits. Your commitment is invaluable. It is valued by the board and by the Yorke and Northern community. We look forward to your continued commitment to providing excellent care across our acute and aged care facilities and working with us as we plan how to deliver those services for our communities into the future.
So we want to thank all of our nursing and aged care and acute workforce for everything they've done for the Yorke and Northern community during this phase of the COVID pandemic. I've done a very rough calculation, and I think from what I can gather, the network has had over 10,000 hours of COVID-based sick leave, isolation leave, and other impacts like that. So to be able to maintain the level of service provision and still provide high quality services to our communities over that time, with those massive obstacles in the way, is an absolute testament to yourselves and the way you've been able to go about things. So we thank you.